So my ADHD is kind of out of control. My office is a mess. My room's a mess. I don't know why I'm recording a video when I should be cleaning. But anyway, the purpose of this video is to talk about how I got a ADHD and autism evaluation as an adult. I am 31 and I think it was last year, 30 when I got um my evaluation. And I know it's like a struggle to get an evaluation or a diagnosis for things like autism or ADHD as an adult because I went through it and it can be a pain. So I'm hoping that this video will help others out there who are looking for resources and kind of looking because you don't really know where to start. So for starters, I have a son, and when about 3 years ago, so he was about 4 years old, maybe three. I took him in to be evaluated for autism because he was exhibiting some behaviors that were concerning for me. He had issues with texture, like I always had to kind of rip the tags off his shirts because otherwise he wouldn't wear them. He is very resistant to change. So if the teacher changed him to a different like desk or moved anything around, he would have a meltdown. Um, just like a number of things that were, I guess, concerning. I went in, and it was really easy to find a place to evaluate him. I have Medi-Cal, which is like poor people's health insurance in California because I'm a full-time college student and I'm only working part-time, so I don't make very much money. I live with my parents. Um, and the issue with health insurance like Medi-Cal is that a lot of times they have really long wait times for you to be seen by providers, but I mean it's better than nothing, right? And thankfully I didn't, there's no copay or anything. Medi-Cal covered the entire like the visit and the evaluation and everything for my son. It turned out that he was not he wasn't didn't meet the criteria, I guess, for autism. I guess some of the behaviors that I mentioned might have been consistent with a mood disorder, which it's very possible because I know that I have ADHD and it's highly, I guess, highly genetic. So there's a possibility that he might also have ADHD, and one of the symptoms is issues with emotional regulation control. And then his dad is bipolar, so there's always the possibility of that. So anyway, point being, this was a couple years ago, um, and then I have always kind of wondered if I'm autistic because I do have cerebral palsy. So um, basically, I have issues with a lot of like, I guess, reading social cues, and I feel like I'm easily overwhelmed if I have too much going on or if there's a change in my environment. I also really dislike sudden loud noises. I guess I'm easily overstimulated by things like loud noises or um, just a bunch of different things in general. And I feel like I have trouble reading social cues. Like, I won't really know if we're in a group setting. A lot of the time, I don't know when to laugh, and I'll just kind of laugh because someone else is laughing. And I think that I've been doing this for so long, I've been masking for so long that it doesn't feel natural, but it's like force of habit. So I decided to go in and see about getting an evaluation for myself. And I looked online, and a lot of them don't accept Medi-Cal, and they were asking for payment out of pocket of like really anywhere from like $2,000 to $4,000 out of pocket, which I couldn't afford. So what I did is I looked at a list of providers that take Medi-Cal online, and then they have like a number on the back of the card that you can call also to ask for like providers in your area. I looked for a list of providers that provide, I guess, neuropsychological evaluations. And I called a couple different places, but the majority of them only do these evaluations for children and not for adults. So really my last resort was to call the place that did my son's evaluation a couple years ago. And so I did, and I called them and I asked them if they did evaluations on adults. And luckily they said that yes, they did, but I had to have it, of course, approved by the insurance. Like their insurance had to approve, I guess, services specifically from them. So I called my insurance and I said, this is the provider that I want to be seen by. And they approved it. It took about a month. And then and then in case you're wondering, if you're in Southern California, and you happen to have Medi-Cal, they are, the name of the provider is Gun Psychological Services. And I believe that they're in Rancho Cucamonga, but don't quote me on that. But yeah, it's Gun with 2 N's, Psychological Services. So, I went ahead, and after I got the referral approved and all that, made an appointment, and the first meeting was actually through Zoom because this was like in the middle of a pandemic, right? And it was very brief, like 15 minutes, and it was like really basic kind of demographic questions, I guess, or about like, age, birthday, what I do for a living, who do I live with, do I work, just like very basic questions. And it was quick. And then after that, I had to make a follow-up appointment for the actual autism evaluation. And that was 2 hours long. And I had to go into the office for that because they really focus on like, I guess, like social aspects of the way that you communicate. And so it has to be done in person. And so I went in there, and that he like asked me a series of questions like, what do what do you like to do in your free time? Do you have friends? Define happiness for me, define sadness. And then also like a series of like number sequence, and different cognitive assessments, I guess, including like number sequencing. So he would tell me, I'm going to repeat a set of numbers to you, and I want you to repeat them back to me. And so it would start with really simple, like maybe 3 numbers at a time, like 5, 8, and 7. And I would just repeat it. And then it got longer and longer as it progressed. And I pretty much got those all right. And I think that probably assesses like working memory. And then he would say, okay, well, now I want you to repeat to me the numbers backwards. And I got the majority of those right. And then there were other tests like, what was it? Recreating a pattern of blocks. And I really struggled with that. And I have always struggled with that because I remember getting those similar tests when I was in school because of my cerebral palsy. I had an IEP, and I attended like adapted physical education and all kinds of special services, even though my CP is really relatively mild because I can walk independently. So anyway, the tasks that I know that were specifically to assess my spatial or visual spatial skills, I did horribly on those, and I know that I've always had issues with that, and I get lost everywhere, and I'm very bad at anything that just requires visual spatial skills. And I have a feeling that might have something to do with my cerebral palsy, or the part of my brain that is affected due to CP, although I'm not entirely sure. But anyway, the part of the assessment that was meant to diagnose or look for autism is that he placed a book in front of me about like like a children's book about frogs, and it didn't have any words. It was just a bunch of pictures, and he told me to kind of tell a story, looking at the pictures. Tell a story or what I think was like going on in the story. So I did my best to do that. And I'm currently taking a developmental psychology, abnormal child development, abnormal child psychology class. I think that's the name of it. Because I'm in undergrad, I'm a senior, and I'll be graduating in May with my bachelor's degree in communication sciences and disorders with the goal of becoming a speech language pathologist, but I do have to go on to get a master's degree as well. And my minor is psychology because that's another field that I considered going into. But for now, I'm just kind of exploring the field because I'm a huge empath, so I feel things tenfold. So I don't know. I feel like it would take an emotional toll if I were to become, a therapist and have to hear out different cases of like kids getting abused and whatnot. I don't know how well I'd be able to handle that emotionally and mentally because I'm so much of an empath, which is why I decided to, at least for now, just go with a minor in psychology and focus on speech pathology. Anyway, so like I was saying, that class that I'm taking right now, one of the psychology classes I'm taking focuses on like how different childhood disorders are diagnosed. And among those, we talked about ADHD and autism and bipolar disorder and whatnot. And so my professor, who also happens to be a therapist, um, said that what they're looking for when they're asking you to recreate the story of that frog picture book that they were using is to see if you kind of focus specifically on like small details and can't really see the big picture. If you tend to hyper focus on, like, for example, the windows, how small the windows are, or maybe something on a tree. I guess that is a characteristic of autism that they might be looking for. But I'm not an expert. This is just based on what my psychology professor told me. Anyway, so after the 2-hour assessment was over, he told me that I do not meet the criteria for autism, although I do display some characteristics of autism, but I guess just not enough to be diagnosed with it. Although I'm still not really convinced because I feel like I've been masking for so long that I just automatically do it. But he ended up diagnosing me with uh, inattentive ADHD, which I was shocked because at the time, the only type of ADHD that I was aware of and that I knew was the impulsive, hyperactive type, with the little kid bouncing off the walls and not being able to sit still. And I was like, well, that's can't be me. I'm like the opposite of that. But as I became more informed about the condition and about the fact that there are 3 types of ADHD and like the symptoms and that tend to manifest with inattentive ADHD, that makes a lot of sense. And those are things like forgetfulness and being disorderly, unable to kind of keep a clean space, and um, just like a whole host of things, really, that comes with the inattentive ADHD and pretty much sums up my life. That's not to say that I don't think that I'm autistic. I'm kind of on the fence when it comes to that. I don't want to self-diagnose, but I feel like there's something else like kind of at play, and I just don't know what it is, what it might be. But anyway, point being that the evaluation was entirely free. I went in for an autism evaluation, and when they do like a neuropsychological evaluation, they also look for other possible disorders. So I walked out with a diagnosis of inattentive ADHD. Um, and so I would say if you don't have insurance, you're going to have to pay out of pocket. And the quotes that I got from people that like I found, it was just ridiculously expensive. And then I would say if you do have insurance, start where you can find providers near you that take your insurance that do autism assessments for children, because you're going to be able to find a ton of them, and then kind of call them individually and ask them, do you also provide autism assessments for adults? Or ADHD assessments, whatever it is you're looking for adults. And if they say no, ask them if they might be able to point you in the direction of someone who could possibly provide that. And then it's always a good idea if you have insurance to call like whatever numbers on the back of your card and ask them for a list of providers specifically that provide like neuropsychological evaluations for adults. I'm gonna kind of read a little bit of the I guess diagnosis or what was written on my report after after I went through the assessment and all that, and so that you guys can kind of get an idea. So give me a second while I pull it up real quick. Okay, so starting at the very beginning, um, it has on there the reason for referral and the purpose of the evaluation, um, and what tests specifically or evaluation instruments they administered, which were the Autism Diagnostic Observation Schedule, second edition, or the ADOS-2, a biopsychosocial clinical interview, a mental system assessment, advanced edition MESA-AE, a post-traumatic stress disorder checklist, 5th edition PCL-5, and a Wechsler Adult Intelligence Scale, 4th edition. And then it talks a little bit about my background information, like family background and all that information that I gave him regarding my history, my education and employment, and my medical and psychiatric history. And on here where it gets to behavioral observations and validity of examination, says on here, she presented on time for her intake on February 18th, 2021. I don't know why I thought this was like a year or two ago when it was this year in February. That's how bad my, I guess, my time management and sense of time is, because this to me feels like 2 years ago, but it was apparently just a couple months ago. Inattention present was careless. Careless mistakes, issues focusing, not listening, not following directions, disorganization, distractibility, hyperactivity of fidgeting, and restlessness. Ms. Montoya arrived on time for testing on April 8th, 2021, was adequately groomed and casually dressed. Vision and hearing were adequate for examination. No tremors or abnormalities were observed. And she was oriented to time and place. Word finding and comprehension were adequate to conversational screenings, and speech rate, quality, and tone were normal. Thought processes were appropriate, and mood was reported as good. And affect was congruent with intake. There was no evidence of perceptual abnormalities, and she was cooperative, gave sustained effort with no identified motivation to malinger. Observation of performance suggests that test results are likely a valid representation of current ability level. She was administered the ADOS-2, which is the Autism Diagnostic Observation Schedule. In language communication, intonation was adequate, expressing her experiences She offered spontaneous information on her thoughts, but did not inquire about life event information and conversational leads. I don't really know what that means. Maybe that I didn't seem interested in his part of the conversation, or maybe that I didn't. Um, I really don't know. Just I didn't inquire about life event information and conversational leads. I don't know. Providing emotional gestures was developmentally appropriate but lacked insight. I also don't know what that means. I mean, I don't know. The verbiage on here is kind of confusing. Providing emotional gestures was developmentally appropriate but lacked insight. Like, what insight exactly was it lacking? It's not very clear. In reciprocal social interaction, eye contact was appropriate with appropriate facial expressions. Can I just say that eye contact is still extremely uncomfortable for me, but I just do my best to maintain eye contact. That doesn't mean that it doesn't make me nervous. She showed responsibility to her actions. Social overtures were inadequate. Again, what does he mean by that? I don't know. And social response and reciprocal communication frequency was appropriate. In imagination, she read the book as directed, which I'm assuming here they're talking about that frog book that I was talking about earlier. Saw no humor or nuance in the book and told the story about her academics. In stereotyped behaviors or restricted interests, she did not present with unusual sensory interest or self-injurious repetitive behaviors. In other abnormal behaviors, she displayed no abnormal behaviors. Cognition, this is where it gets interesting, kind of. Says she was administered the Wechsler Adult Intelligence Scale, 4th edition, to assess adult cognition and memory. Full scale IQ was low average, so average but low average, I guess, at the 12th percentile. Results suggest this is a reasonable estimate of cognition with an index examination. Verbal comprehension, or VCI, or the understanding and retaining of verbal information, was average. Language development was a strength, as evidenced by subtest score distribution. Perceptual reasoning, or PRI, or perceptual reasoning or processing novel visual information, was borderline. When he wasn't very clear, like he didn't really explain the whole report thoroughly, but when he was kind of going over this part where the processing novel information or the perceptual reasoning was borderline, he said if you had scored 2 points lower on this particular part of the assessments, I would have to make a recommendation that you don't drive, that I shouldn't be driving, I guess. Which, I mean, I guess it makes sense because driving is something that I've always struggled with. I don't drive. My goal is to one day learn to drive, but I struggle a lot with like managing and my attention and kind of focusing on everything that I have to focus on. And I have terrible visual spatial skills, and driving has even learning or attempting to drive has always been a struggle for me. And so when he said that, I said, yeah, I um, have always kind of struggled with that. And then it says on here, spatial perception was a weakness as evidenced by subtest score distribution, which I was not surprised by. I have already mentioned multiple times that I have terrible spatial skills. And then working memory, or holding and manipulating information in short term, was average, and sequential auditory memory was a strength. So I'm assuming that's that test that I told you guys about where he has me repeat back a string of numbers. I guess that was testing the sequential auditory memory. Was a strength as evidenced by subtest scores distributions. Processing speed or mental processing speed under time constraints was borderline. So I'm assuming I did really, really bad at that. The whole processing speed thing, which doesn't surprise me because I do feel like it takes me a while to process things sometimes. And I don't know if that is related to the ADHD or the cerebral palsy or both. And then it says on here, visual motor coordination was a weakness as evidenced by subtest score distribution. And then it goes on to executive ability. And then it says on here that was tested by the Mental System Assessment Advanced Edition, or the MESA AE, to assess attention control and cognitive flexibility. Self-regulation and goal achievement was extremely impaired. I guess I don't know exactly which of the tests specifically, of the tasks that he had me do, were for testing executive function, but apparently I did very poorly on that because it says extremely, self-regulation is extremely impaired. Selective attention, visual spatial sequencing, and processing speed was extremely impaired, which again does not surprise me. And consolidation of working memory and visual spatial classification was extremely impaired. Then it goes on to mood, and it says that he gave me an assessment for post-traumatic stress disorder, and criteria was not met. And then it goes on to functional implications and diagnostic impression. So under functional implication, it says autism results indicated criteria was not met. But see, this is where I got kind of confused, because right after that it says cognition results were consistent with profile of an adult with autism. Executive results indicated impaired ability thinking on her feet. So how is it that the autism results indicated that the criteria was not met, but then it says my cognition results were consistent of an adult with autism? That's kind of contradictory. And then it says, executive results indicated impaired ability to think on her feet, which does not surprise me, I guess. And then it goes on to diagnostic impression. It says she reported autistic symptoms of listening to music to relax. I didn't know that that was an autistic thing. Likes to play piano, likes the piano, watch superhero shows like The Flash, dislikes being touched and loud music, pervasive anxiety that began in middle school and manifests as restlessness, irritability, fatigue, and issues concentrating. She, let's see. Inattention present was careless mistakes, issues focusing, not listening. Well, I think this is just like a repeat, I think, from what it said at the very beginning. And then at the bottom it says, based on information gathered during the assessment process, mood issues met diagnostic criteria, met the Diagnostic and Statistical Manual of Mental Disorders 5th edition criteria, which is the DSM-5, which is what they use to diagnose, for 300.02 F41.1, which is generalized anxiety disorder. Attention issues meet criteria for 314.00 F90.0, which is the code for attention deficit hyperactivity disorder, or ADHD. Inattentive type. Criteria for autism spectrum disorder was not met. At the bottom it says on there, generalized anxiety disorder and ADHD. And then under summary, again, it goes into kind of repeating of some of the stuff that it says at the top about the cognition results and executive results and all of that. Executive results indicated deficits in attention, cognition, flexibility, and self-regulation. Mood results indicated no issues. And Sorry, I know this was long, but just in case anybody was kind of wondering what goes into one of these reports, this I kind of went over it all. And at the very bottom, it says treatment recommendations. Um, and this was actually really helpful because even though I do have cerebral palsy, um, I didn't know that I had ADHD until I had did this assessment. I knew that I struggled with, like some executive function tasks and kind of um, I have really poor time management skills, and that was really a struggle, like when I was taking tests and whatnot. But I never, ever, ever thought to look for accommodations, like as far as academic accommodations, until after this assessment. Um, and because I have this diagnosis, I was able to give this to show it to my university and get accommodations for my ADHD. And one of those accommodations is getting extra time on exams. So I would get like a time and a half, not double time, time and a half for exams, and I get to like take my tests in a quiet room, to kind of minimize distractions. And I also can record my lectures in school if I choose to, because sometimes it's easier for me to focus when I'm at home and listen to my lectures and take the notes then. But that really hasn't been an issue this year because the majority of classes have been online anyway, and a lot of the lectures are already recorded. So anyway, at the last part of the assessment report that I'm kind of going through right here, it says treatments recommendation, consult with the university, academic success and disability services for academic accommodations, such as preferential seating at front of the classroom to reduce or eliminate excess stimulation in desk area, separate area in a quiet room free from excess stimulation. Um, is it excess or excess? Oh, and anyway, free from distraction for tests and homework, note-taking services, or lecture recording to help mitigate attention issues, and that has been super, super helpful. Extended time on test. Extended time on testing, essays, long-term projects, and any other time-dependent tasks. Because again, people with ADHD have horrible time management skills and pretty bad sense of time, I guess. Continued individual therapy to ameliorate mood issues. Consult with PCP about potential medication evaluation for mood and attention issues, which I have, and that's why I'm taking the Ritalin and also the Zoloft for the anxiety and depression. Contact the rehabilitation department, which I also have, and the Department of Rehabilitation in California. I don't know if it's like this for every Department of Rehab, but they're actually helping me pay for some of my tuition at school, and they also cover the cost of textbooks. Contact human resources for employment accommodations, extended time on work, tasks, long-term projects, usage of mindfulness to help mitigate attention issues. I can never sit down for long enough to practice really mindfulness meditation, but that's something I want to kind of get into. Anyway, I know this is long and I made a lot of mistakes and stuff reading it. I don't typically edit my videos, so I didn't realize how long. Wow, I think this video is like going on over 30 minutes now. But yeah, so I guess I'll be back later. Let me know if you guys have any questions as far as like the whole evaluation report, or the as far as getting evaluated and all of that, and I'll see what I can do. I'll do my best to answer.